Yes, can we go to the next slide, please? Okay, let's start with some interesting case presentation. So here is a 2.5 month, 2.5 month old baby who presented with history of runny nose since last 3 days, cough since last 2 days, which has persisted with post-tussive vomiting, low-grade fever, but that lasted only for 1 day. The child otherwise is reasonably well. An older sibling had a history of coryza. On examination, you feel that the child is absolutely normal. There is nothing significant that you have seen. Their entry is bilaterally equal. So, Dr. Ahmed, if you have this child, 2.5 month old, who comes to your OPD clinic, how are you going to manage him?
Actually, by this history and the examination, which looks normal, by general examination and systemic examination, this goes with viral. It's viral upper respiratory. And viral upper respiratory just to assure the parents. Actually, the parents it is causing anxiety to pediatrician. So it's just reassurance, increased hydration, no need for antitussive medication because it's not recommended. Okay, just hydration, the antibiotics if needed.
Excellent. Excellent. Can we go to the next slide? I think as Dr. Ahmed mentioned, I think this is the best possible treatment that you give. And like he's already answered a question, which cough medication is indicated in this child? I think this probably should have been a question to the audience, and he has rightly mentioned about nothing, antitussive or antihistaminics, absolutely not needed. Bronchodilators, saline nebulization, no. And as he has mentioned, it would just be a plain viral upper respiratory tract infection. Just asking and speaking to the patient and counseling would do the needful. And Dr. Ahmed, is there anything that you can put your light on, in similar case in neonates, if you think they have prolonged cough, who come with severe distress or tachypnea, but the cough is still persisting? Have you come across these paraneonates or neonates where you have persistent cough?
Yes, and neonatal cough is we should take seriously and should parents seek medical staff immediately because the neonatal cough you should take it seriously. You should treat the underlying cause. As in general, we shouldn't use antitussive medication, not using honey, not using OTC medication. Neonatal cough can be divided into either congenital anomaly in the trachea or bronchi, or infection, such as a chlamydial infection, which can cause this staccato cough and eye discharge. Also, we should exclude the GERD, gastroesophageal reflux disease, if it is the cough presented with feedings or after feeding. So we should treat the underlying cause, and according to the cause, we should treat it.
Right. I think you have mentioned a very valid point, and you need to be mindful again when you're dealing with the neonatal age group or the paraneonates with persistent cough. So, as you rightly mentioned, chlamydial infection is one of the differential diagnoses which should be present if you think that the cough is prolonged, or if the child has other prodromal symptoms. Well, okay, can we go to the next question? Next case. Okay, so we have now gone to a little older child who is a 3-year-old child, and he's a toddler who's present with similar history of cough since 3 years, running nose since 3 days, fever since 3 days, high grade, intermittent, responding to antipyretics. Cough is persistent and now it's dry, but he also has, mostly post-tussive. And they started almost it has started preschool in the last 3 weeks. So the child has got cough, which is going on for a past 3 weeks. But general examination, you feel there is nothing significant. You feel the respiratory rate is normal, the air entry is normal. So now what would you like to do, Dr. Paul? Would you want to treat this child, or would you want to just wait and watch? Or how would you go about treating these kind of children in this age group?
Well, yes, we have a 3-year-old child here who has just started going to school. So I presume it should be, yeah, it's a preschool. Started with fever and running nose for 3 days, and which is intermittent, but it's high grade, but responding to antipyretics, and also a cough, which is a dry cough. So it mostly looks like a seasonal upper respiratory infection, most likely a viral, of a viral etiology, and also the general and systemic examinations are quite normal. So I wouldn't really be worried about this case. Reassurance definitely for the parents. And I would give them a choice of maybe a herbal preparation of a honey. Honey is like an antitussive because that helps to soothe the child's throat and also maybe helps to reduce the cough to an extent. Because the child has a running nose, maybe the postnasal drip must be irritating the child, so a saline drops will help definitely. Then hydration definitely, that should be explained to the parents to keep the child well hydrated. And also, humidified air could be definitely be advised, mentholated chest rubs also can help the child.
Right. As you rightly mentioned, now that we have an array of herbal medications, I remember honey, ginger, all these products have been used beforehand with our grandparents and honey. There has been, in fact, a lot of scientific studies, and now Dr. Komal would in our the next upcoming slides probably brief us more on the upcoming safer options that we can use in children. Excellent. Dr. Paul, I think as you rightly said, this could again be post-viral. And now that we have, speaking to the parents, just counseling them and telling them that it could be just post-viral or post-viral underlying cough, I think that should be needful. And if at all, if they feel that, then probably yes, giving some homemade remedies, which many parents do ask me as well, if it's okay with giving home medications. So we'll talk a little more on those as we go to the to the next upcoming slides. Can we go to the next slide, please? Okay. I think Dr. Paul has already answered this question. We can go to the next case. Yeah. Now, as we see that we are continuing the same case. Now, here you feel that the child has symptomatically improved, as in the fever has settled, but he still continues to have intermittent cough, and now for mostly 4 weeks now. But now you see that the cough is gradually becoming wet, and it's present intermittently throughout the day. Now, if you ask more detailed history, you will want to know whether the child has got diurnal and postural variation, but otherwise nothing significant in the past or the personal history. When you check on examination, the respiratory rate and saturation is normal. Systemic examination, still you don't find anything particular. So now that this child is almost 4 weeks, now would you want to do anything? Now would you want to start him on any antibiotics, anti-cough medication, or any antitussives or any antihistaminics? Dr. Paul?
Well, yeah, the child has symptomatically improved, as in the fever has subsided, but the cough is still persisting for the last 4 weeks. I wouldn't classify this as a chronic cough because it's less than, it's just 4 weeks. It's not crossed the 4 weeks time. So it could be a protracted cough or a persistent cough. The reasons for persistent cough could be many, like infections, post-infection. It could be allergies. It could be asthma. It could be GERDs. And it could be like even a foreign body, like you have already mentioned, Dr. Manisha. So, but after looking at the general examination, systemic examination, and also the bit more questioning which you have asked, there has been diurnal and postural variation, and the cough is mostly wet. So I would like to treat it like still like a post-viral, upper respiratory tract infection. My differential diagnosis would be maybe it could be a cough variant asthma also. But in that case, I would like to go into a bit more of the history, or I would like to ask the parents if the child has more cough while exercising or crying, so which could make a diagnosis of a cough variant asthma also. Otherwise, I feel it could be just a post-viral upper respiratory tract infection.
Right. Can we go to the next slide? Okay, I think you have already mentioned about this. So presently, according to you, we will still hold on and refrain from using any antitussive or antihistaminics and mucolytics or bronchodilators, since right now the child does not have any symptoms pertaining to any allergies or allergic rhinitis or any wheezing. Symptomatically, this child seems to be improving other than the cough. And like you rightly said, post-viral cough, we can wait till 4 weeks duration. Correct. Can we go to the next slide? Okay. Now, this is a 6-year-old child with dry cough since 1 month and mostly nocturnal. Intermittent cough while running and playing was started on Montelukast and levocetirizine with intermittent relief. has significant past history where similar kind of cough, and he has been used this most commonly used combination of Montelukast and levocetirizine and bronchodilators. So Dr. Ahmed, first of all, I would like to ask you, have you used these medications in combination, or do you think it's a good idea to use these medications as separate entities or separate medications? And how has your result been? And I think we all know that we are treating a child with asthma here, so we are not going to treat on, go more on the asthma treating guidelines. But what we are trying to focus here on the combination that we have just mentioned here.
Yes. Regarding Montelukast and levocetirizine, levocetirizine, this is the second generation antihistamine. We can use it if there is an atopic and allergic rhinitis associated with asthma. Regarding the Montelukast, this is the prophylactic treatment for the asthma. We can use Montelukast and levocetirizine as combination. Yes, we can use it, but for short duration of levocetirizine. We shouldn't exceed more than 2 weeks in levocetirizine because it causes rhinitis in the mucous membrane, which is induced cough. Regarding the bronchodilator, of course, we can use bronchodilator because this is 6 years old child with a dry cough, persistent more than 1 month. So it is straightforward. It's an asthmatic case. And according to the severity, we can use inhaled steroid or not.
Right. So I think, as you mentioned, you would prefer to use these, not use this medication in combination. You would rather prefer using Montelukast all alone, or if you think the child has got symptoms suggestive of allergic rhinitis, only then add levocetirizine. And bronchodilators, we always would prefer using in the form of inhaler and not in the form of, oral medication. Can we go on to the next slide? Right. So like I asked, like we mentioned here, the child has got itchy nose, blocked nose, and he was feeling a little better with Montelukast and levocetirizine. Both parents have allergic rhinitis, and now you see the child has got bilateral polyphonic wheeze. Rest of the clinical examination was normal. Can we go to the next slide? Right. So this, I think Dr. Ahmed has already answered us if he has used this combination. So he's answered this question. And any cough or other cough, any other options that are available, which you have mentioned using bronchodilators in the form of inhaler and low dose corticosteroids would probably work best if you think asthma is your working diagnosis. Can we go to the next slide, please? Right. Yes. So levocetirizine therapy with natural cough syrup in allergic cough. I think Dr. Komal, can you put a light on what are the natural cough syrup that are there in your medications?
Sure. Thank you, Dr. Manisha. So, a range of polyherbal formulations, syrups, and lozenges with a proven quality and good manufacturing process are used in cough management. In the Indian classical texts like Charak Samhita and Shushrusha Samhita of Ayurveda, various individual herbal medicines are mentioned, like you mentioned Tulsi, Ocimum sanctum, or Zingiber officinalis, aloe vera, licorice root, Glycyrrhiza glabra. These are the various medications which are having anti-tussive and expectorant qualities have been mentioned. One of the points you highlighted, ma'am, in your session is that currently the recurrent upper respiratory tract infections are very common because of this air pollutions and the poor air quality. So where the inappropriate use of cough medications we need to avoid. So in this issue, this Ayurvedic herbal medicines are the safer options. And one of the another quality mentioned with these herbs is that they are having rejuvenative properties, like they enhance the immune system, the respiratory health of a child. So that's another advantage which these herbal medications are providing to the children. Honey we are using commonly about 2 years of age. It's a well-proven medicines which we use in such children's.
Absolutely, absolutely correct. Can we go to the next slide? And I think as Dr. Komal has mentioned, which antitussive and, why antitussives won't work, because most of the times, these children, it's a post-viral underlying inflammation, so they would just settle on their own. Can we go to the next slide? as Dr. Komal mentioned, use of herbal medication, specifically cough, as mentioned with honey. Like we have a lot of studies, which actually I was quite surprised. A lot of research publications have been there with honey, menthol, tulsi, and which may not be available so freely outside our Indian subcontinents. But as she mentioned that now we do have preparation in either lozenges or medications in either a tablet or a syrup form. Am I right, Dr. Komal?
Yes.
Okay, okay. So, and are they effective and safe? Because honestly, we've never had any experience using them. And to let you know, there are a lot of parents who come to me and they've already been started on herbal medications, because they feel it's a safer option than giving the other antitussive medications. So, how effective and safe are they?
Yes, there are preparations available, ma'am. Like they are proven quality with a good manufacturing process they are used, and there are many studies are available, especially in older children above 2 years, that these drugs are very useful. So efficacy and safety is very established with this quality proven medicines. Another part, ma'am, I would like to highlight like some home remedies we generally prescribe, like in older children, a simple our turmeric, if we mix it with the milk, the hot turmeric milk, or the ginger tea, or the tulsi decoctions, or the licorice powder with the honey. So these are some simple tips with the steam inhalations are very useful for the cough management in such school going children. These are the safer options.
I think all of us in the Indian subcontinent must have some time in their life been treated with these medication by their mothers or the grandmothers, and I'm definitely sure they've gotten better. I think I must have definitely gotten better with these medications. So yeah, to some extent, I can definitely vouch for these medication that we have worked. And like you said, they do have a scientific data which has been published now. So we are working on those publications which are there right now. Can we go to the next slide? Okay, I think we have already used this. And which of the above work the best? If we ask about honey or other herbal remedies, and and what to be used is decided on what basis?
So, in the Ayurvedic classical text, we have divided the individual patient based on his prakriti. That's the basic of Ayurvedic treatment. It's Vata, Pitta, and Kapha. And based on that, these polyherbal formulations we use, which are having the expectorant and anti-inflammatory activity. And specifically, we use the drugs which are having this rejuvenative properties, like we mentioned tulsi or Zingiber officinalis or the licorice roots, which not only have an antitussive and actions, but they helps in improving the immunity. So that's the basic of these drugs, and it has proven in studies that these are effective in such types of cough management in the children.
Okay, so out of my inquisitiveness, I want to ask now that we have international speakers and we have a lot of international crowd. All the Ayurvedic preparations that you have mentioned, do you think they are available beyond the Indian subcontinent? Yeah, Dr. Komal?
Yeah, so we one of this we have like Z-cup syrup, which is the polyherbal formulations and lozenges and syrup, which is available more than 15 countries, which has a proven studies about 2 years of age. It's a safer options in the older children for the use, and all these ingredients which we mentioned are used in this preparations. It's available in almost more than 15 countries.
Okay.
For use.
Okay. Can we go to the next question, please? Okay. Okay, so I think what our esteemed panel has come to about first of all, what is the cough syrup, whether to use or not to use, what are the underlying etiologies that we need to treat, should we use antitussives or not use antitussives, what are the side effects of antitussives that we commonly use, and sometimes they can be life-threatening as well. So, Dr. Paul, can you just give one take-home message? How do you deal with cough?
Well, regarding cough, I would say treat the cause, not the cough. And cough is a symptom, not a disease. And like you said in your presentation, it is a reflex mechanism of the body to expel any irritants in the upper airways. Always a history is very important because that could lead us to a diagnosis rather than treating the cough and then waiting to make a diagnosis. But always look for the red flags associated with cough. And if you see any red flags, immediately you have to deal with it. And this is what I would like to say all our viewers today.
Right. Dr. Ahmed, can you give us, one take-home message how we deal with cough?
Yes, Dr. Manisha, the cough is very common in pediatrics and one would cause an anxiety to the parents and to the child itself. Because the cough, we shouldn't use antitussive medication for the age below 2 years because it can cause serious side effects. We should use it above 2 years. We should seek a medical advice if the cough is persistent for more than 3 weeks, because maybe seek for the underlying cause. Maybe it's not just a viral, maybe another cause, for example, foreign body.
Right. Yes, Dr. Komal, would you want to add some?
Yes, I just would like to add that instead of using recurrent cough medications and the antibiotics, adjuvant to that, use the safer herbal formulations options which are available, which has effective and safe, and along with that, improve the immunity of the child, not only with the home remedies, and also the yoga and pranayama, which are told to improve the immunity. So use these techniques to overall build the immunity and use these safer options.
Yeah, but probably 1 year and a little younger age group, yoga would be and pranayama would be a little difficult option to do. Yeah, but maybe that's maybe an older child we don't have older kids also listening. So fine. Can we go to the next slide? So I think what we have come to this conclusion is, I think, where what all our esteemed faculty members have mentioned. So first and foremost, whenever you have a child with cough, you need to know a detailed history, physical examination, what kind of cough it could be, what are the underlying triggers that could be increasing the cough, see how the child is clinically. If you think the child is deteriorating or the child is improving, based on these underlying characters, do you think you need to prescribe any antitussives depending on the age factor?